Gentle or family-centered C-sections. What are they? Are you wondering what is gentle C-section or family-centered C-section? Are you wondering if it's right for you? In this video, I am going to answer those questions and many more. So stay tuned until the end of the video so you don't miss anything. Hi, I am a medical practitioner, a mom of 3, and your trusted source for all things periods, pregnancy, and everything in between. If you like what you see here, don't forget to follow, like, share, and put on the notification so that you don't miss my new videos each and every week. So what are gentle or family-centered cesarean sections? This is a new term that has been coined to describe a cesarean delivery that is performed with some modifications to allow the family to be more involved in the birth experience if they choose. Up until now, we really haven't had options when it comes to how a C-section is performed. It is usually a very quick procedure with minimal interruptions, and parents are typically not allowed in the operating room. But times are changing, and there are some hospitals around the country that are offering cesarean deliveries where the family can be more involved in the birth of their baby. And I think this is great. Why? Because when we talk about the benefits of vaginal delivery, we often focus on the benefits for the baby, especially the health of the baby's gut microbiome. The reason why we talk about that is because the vagina has a ton of good bacteria that baby is exposed to during a vaginal delivery that can help set up that microbiome. And that helps prevent things like eczema, asthma, and even obesity later on in life. But studies have shown that babies born via cesarean section actually have a higher risk of developing asthma and allergies. And the reason for that is thought to be because they were not getting that good bacteria from the vagina that they would get if they were born vaginally. But it is also possible that this is due to mom not having that positive birth experience and not being able to pass on that positive feeling to baby. There was an amazing study that was published in 2021 that looked at over 18,000 mother-baby pairs in Denmark. And what they found was that if mom had a positive birth experience, baby had less allergies, eczema, and asthma. Now this is important because the bond between mom and baby starts being formed long before baby is born. And our emotions and feelings can actually be passed along to our babies through the amniotic fluid that they are swimming in. And when mom is calm and relaxed, that baby can sense that and will be more relaxed as well. But if mom is anxious or stressed or overwhelmed, baby can sense that too and will be stressed out as well. So keeping mom calm and happy during labor and delivery can actually benefit the baby in the long run by potentially preventing them from having issues like asthma, allergies, or eczema. But what does that look like in practice? Well, a gentle cesarean section allows for delayed cord clamping. Delayed cord clamping is something we've talked about a lot in the birth world because it allows that baby to get more blood from placenta, which can help prevent things like jaundice and low blood sugar. And it can also help boost that immune system and prevent things like asthma, allergy, and eczema. A gentle cesarean section also allows for immediate or early skin-to-skin contact. And we know that skin-to-skin contact is associated with improved outcomes for both mom and baby. For mom, skin-to-skin contact releases oxytocin, which helps the uterus to contract and decrease the risk of postpartum hemorrhage. For baby, skin-to-skin contact improves thermoregulation, improves breastfeeding outcomes, improves sleep, and decreases the need for pain medication. But perhaps most importantly, skin-to-skin contact increases the amount of good bacteria that baby is exposed to, which can have long-term health benefits for them. Delayed cord clamping and immediate skin-to-skin contact are two major components of a gentle cesarean section. But another component is allowing dad or another support person in the operating room during the birth. We know that a positive birth experience is one where the patient feels empowered and informed, and sometimes having your partner there to support you can be a huge part of that. Of course, not every hospital allows for partners to be in the operating room during cesarean deliveries, And there may be some restrictions based on the type of anesthesia that mom is receiving or other factors. But allowing for a partner to be there during the birth of their baby can help them feel more connected to the birth experience and more confident as new parents. And finally, another component of a gentle cesarean section is allowing mom to hold baby after birth. You might be thinking, well, duh, of course she gets to hold her baby after birth. But the truth is that after a traditional cesarean section, mom is usually wheeled out of the operating room while the OB/GYN finishes up in there. And then mom doesn't actually get to see her baby until she gets back to the floor and maybe even change into a gown and get all settled in before baby comes in for a first little visit. That could be anywhere from 30 minutes to an hour or more. And believe me, that is an eternity when you're excited to meet your brand new baby for the first time. Allowing mom to hold baby immediately after birth allows her to enjoy that special moment and begin the process of bonding with her baby. This can also help increase oxytocin levels, which can help with uterine contractions and decrease the risk of postpartum hemorrhage. Some of the biggest benefits of a gentle cesarean section are for the baby, even though the surgery is obviously for mom. And we know that babies born via cesarean section have worse outcomes when it comes to their health. So doing what we can to mitigate that risk is important. And these small changes, like delayed cord clamping, immediate skin-to-skin contact, and allowing mom to hold baby after birth can make a big difference for that baby's long-term health. But what about the mom? What are the benefits for mom? Well, honestly, it's the same thing. All of those things that are good for baby are also good for mom. Delayed cord clamping and immediate skin-to-skin contact can help with breastfeeding outcomes and postpartum recovery. And allowing mom to hold her baby after birth can also help her start that bonding process and make her feel more connected to her baby. If you're interested in learning more about gentle cesarean sections, I encourage you to check out the birth center at a hospital near you. Some hospitals offer gentle cesarean sections in their birth centers, and the birth center is designed to feel more like a home birth than a traditional hospital delivery. If you're interested in learning more about what to expect during a home birth, check out my video about the top 5 things you didn't know about home births. And if you're wondering if you can request a gentle cesarean section at your hospital, the answer is yes. Sometimes these types of requests need to be made in advance, while other times they can be requested during labor. Every hospital is different, so be sure to ask your care team about their policies regarding gentle cesarean sections. The bottom line is that if you're planning to have a cesarean delivery, you deserve to have it done in a way that makes you feel comfortable and cared for. And your baby deserves to start life with a boost to their immune system and a healthy dose of good bacteria. Thank you so much for watching today. As always, I want to remind you that I am not your doctor. I am just sharing helpful and useful information to help you through your pregnancy and delivery and motherhood. Please comment below and let me know if you have any questions. I love reading your comments and I love responding to them. And if you haven't already, please follow me so you don't miss my videos each and every week.